Hey people of the podcast universe, this is your host Dave off of the Well Nothing Is Happening podcast. So today I actually have another guest that's not Alia, surprisingly. This one, so her name is Niki, and she's also a fellow med student at our school. So I'm just going to let her introduce herself.
Hello podcast. I am so honored to be here today, Dave. I have to follow Alia's shoes, so this is going to be a hard one, but so like Dave said, I'm also a fourth year med student, currently going through the same interview stress that Dave is. But yeah, there's really not much else going on in my life.
All right, fair enough. Also, we are recording outside. Sorry, a plane just kind of passed us. I feel like just every single time we start recording or anything we do,
there might be a lawnmower going by later. It'll be fine.
Yeah, it's fine. But overall, well, I'm glad that you can join us today, Niki.
Thank you so much.
So I guess overall, how's your week been?
So far the week's been okay. I had an interview yesterday, went pretty well. I had a really good feeling about the program and the people that I met. I have a few more socials and interviews coming up this week, so just trying to prepare for those.
Okay, very nice. I'm actually in the same boat, doing interviews and kind of all of that. I'm pretty sure the audience already knows. But overall, not really much has really happened. How was your Thanksgiving? I know that I didn't post anything for Thanksgiving.
Yeah, so for Thanksgiving, actually, I was in LA.
Oh.
I was with my family there, spent some time with aunts and cousins over there, and then also explored LA, went to San Diego, that area. So it was a very different Thanksgiving, but a lot of fun.
Did you have any tofurkey or anything?
I did not.
Okay, because actually, so fun fact, my cousin, she is vegan, and so she had like a tofurkey and stuff, and I actually tried it. It was actually not too bad. So Thanksgiving was interesting for me.
What did you do for Thanksgiving?
I was with my family. We always do like a lunch, and then after that, my parents try to yeet it out of there as quickly as possible.
I get that.
Yeah, and I'm just like, okay, whatever, this is fine. But yeah, that was pretty much my Thanksgiving. As for my week, overall, besides the interview, I had one yesterday as well, and I thought it was all right. But really, this past Friday, I had LASIK.
Oh my gosh, that is so exciting.
Yes, and I know that you've had LASIK before too, and now you're about to reach your 6-month mark?
Yeah, it's been about 6 months since I had mine done. How are you feeling after it?
So the first day when I had the LASIK procedure, it's kind of weird because they give you like I'll praise the lamb and
you're knocked out.
and you're kind of like sedated, and you're basically like, it's weird because there's like a part of the procedure where it's like it feels like they put all this pressure on your eyes.
It's so, and then everything goes black.
Yes,
it's so scary.
Yeah, I was like, wow, this is so weird. But at the same time, because of the sedation medication, I was like, I don't care. But at the same time, I was like, this is uncomfortable.
You're like internally freaking out, but your body can't react to you freaking out.
Yeah, exactly. Yeah. Because it was like really weird.
Yeah.
But I remember the whole time the lady was like, yeah, make sure can you wiggle your toes for me? I'm like, okay, I'm wiggling my toes. Like, I don't know. I'm like, I guess this is what I'm supposed to do. I guess just to make sure that I'm awake and stuff.
I see, okay.
Because,
how much alprazolam did they give you?
I don't think they gave me a lot. I think it was like enough to like kind of get me like sleepy.
I felt sleepy. I wasn't like out.
Yeah, I wasn't out either. It was just, I guess maybe because I wasn't saying anything. Mm-hmm. Also, I don't want to say anything when somebody's like doing a laser to my eye.
No, it's like, don't move. No sudden movements. You do your thing.
Yeah, exactly.
Don't breathe.
Yeah, exactly. And it's like I'm trying to like look straight at the laser, trying not look away or anything.
But it's weird because like at that same time, like when you're trying to focus, right, in that little machine.
Yes.
You can't see. Like your vision is still terrible.
Yes.
Like you can't see anything, and the doctor's like, just look straight.
Yes.
What am I looking at? I can't see anything.
Yeah, exactly. I just remember the way the laser was. It kind of looked like an alien, like light thing.
Yeah.
And so it was like a beam me up type thing. I was like, oh my gosh, this is weird. It's like, is this like Alpha of Alien or something?
It was a weird sensation.
But outside of that, that was pretty much the procedure. It was really quick.
Yeah.
I remember when I I guess, sat up from the table, everything was super cloudy.
Yeah.
And I was like, oh my gosh, my vision's terrible. It's fine. And then they gave me like another appraisal lamp, and I was like, all right, well, make sure you go home and, you know, rest and sleep and keep your eyes closed as much as possible. And I tried doing that. But obviously, you know, when I finally woke up back at home, because my dad woke me up, it was like, what is it? So I got home at like maybe 1, 2, and then eventually my dad woke me up at like 6:30 and was like, hey, by the way, it's dark outside. And I was like, and I already had like a pillow and everything over my head because everything was so bright.
Yeah.
And of course, you know, I had to keep my eyes open to like eat and like, check on my messages and stuff.
Yeah.
But overall, it wasn't too bad. The next day, I was already seeing 20/15, so I was like, whoa, this is really cool. Yeah, because I don't know about you, but I had astigmatism and a very high grade myopia. And I think the eye doctor said that there's a potential that I might have to do an enhancement. And I really hope I don't have to do an enhancement.
It was the same for me. Pretty similar experience. Like, I went in, I had really bad prescription, pretty high prescription, and really bad astigmatism as well. And so I went in. I've always really wanted to do LASIK, never really had the right time in our schedule, but it like worked out that I could do it during one of like right as one of our breaks was starting, where I had like time to do the procedure and then go back the next day to do the checkup and stuff like that. And it was the same thing. Like, as soon as I sat up from the table, I could like see the clock on the wall. Like, granted, it was like cloudy, a little fuzzy, but I could see it. And before, like literally 15 minutes before, I couldn't see anything. So it was like wild to see what other people see. Like, remember I was telling you, like, when you look at street lights or like when you look at stoplights, you'll see the actual light and not like the star or like the halo or whatever around the light. It's like, that was the most mind-blowing thing I experienced afterwards. Like, is this what people see? But I can't wait for you to experience that, because like I feel like the first week is pretty, your eyesight's still like figuring out everything, I guess. Like, it's still a little cloudy, it's still a little fuzzy, but like you can see. But it'll like, it gets so clear within a week. I promise. And once you're just like 20/20 without any blurriness or any fuzziness or any glares, it's like a different life. Like, I can't believe people see like this without doing anything.
What day is it now? This is day 4, maybe? It's past 72 hours. So, so
it should be getting better.
It's getting better. Although this morning, like I was telling you earlier, like I woke up and just everything was completely fuzzy. And
it's scary.
It's just because like one of those things where it's like, and also I like I told you earlier when we were eating, I guess, brunch. Basically, like last night my mask was like off my face, and I felt like that there was pressure like on my eye from the mask. And I know that the eye doctor's like, don't rub your eyes or anything. I'm like, oh shoot, you know, my mask was like lopsided. And oh man, that's the worst thing I'd say about this procedure is the mask. Like the procedure was fine. I was just like, I hate this mask. I'm so ready for like Friday to come, because then I don't have to wear this thing again, because I think you only wear it for a week. That's
what they told me too. And guys, if you don't know what we're talking about with this mask, after LASIK, the laser like cuts a flap in your cornea and like shaves down your cornea to the right thinness or thickness that it needs to be for that individual person's eyesight. And so that flap is still technically open right after you do LASIK. So they give you this almost like chemistry lab mask thing that you wear to sleep every night, so that you don't accidentally bump your eye on your, like, you don't bump your arm into your eye, or you don't rub your eye at night. And it is the most uncomfortable thing I've ever had to sleep with. Like, at one point I woke up the next day and I had taken my mask completely off, and then eventually, like within just 7 days, I broke my mask somehow. So it is very uncomfortable. You don't get a good night's sleep like for the first 7 days after this procedure.
My sleep's so fragmented right now. That mask, I wake up like randomly in the middle of the night.
And it's like so scary, right? Because you're like, my eye is not completely healed. So if I move this flap in any way, like if they tell you don't rub your eyes for like a month to 3 months because you could potentially move that flap, So imagine, like, because when I got it done, it was during allergy season.
Oh,
so, like, imagine just, like, your eyes so itchy and you can't itch them. Guys, it was the worst sensation ever because you're just terrified about your eyesight for that time.
I mean, that's me right now.
Yeah.
So, yeah.
The fear will go away, Dave.
Okay, cool. And then also another big thing, so with LASIK, like there's this thing called LASIK dryness, like eye dryness.
Yeah.
So I'm kind of experiencing that sort of, especially when I'm staring at my screen for like interviews.
Yeah.
How often did you use those, like, what is it, preservative-free, single vial eye drops? Yeah, how long did you use that?
I personally didn't experience too much dryness.
Okay.
My cousin who had it done just a few weeks before I had it done, she experienced a lot of dryness. Okay. So I think it's per person, but my doctor told me even if you don't feel dry, at least put them in every 2 hours when you're awake.
Okay.
And so I really had to force myself to do that because I didn't feel like my eyes were dry, but as medical students, we're always looking at a screen. Whether it's like doing notes, looking at charts, doing interviews, whatever it is, like everything's on a screen.
Yeah.
So I knew I had to hydrate my eyes pretty often. So I kept my eye drops, and I still have some left over that I've just like kept if I ever need them for, you know, anything. But I always kept them in the fridge. So when you put them in, it gives like this, it feels really comfortable. And especially like the first few days right after, your eyes feel uncomfortable. Like they don't hurt and they're not like annoying, it's just uncomfortable at times.
Yeah.
And so when you put in like a cold eye drop, it really helps.
Yeah, I definitely have noticed that my eye strain, you know, before in the past I've never really had eye strain.
Yeah.
But now it's like I know what they're talking about because like whenever I stare at a screen for too long, it's like I notice that my eyes just hurt. And I'm just like, wow, this is really weird.
Yeah.
This is the first time I've ever actually experienced it. I hope it goes away.
It does. Okay. I experienced it too the first week. I actually had my 1 week checkup. I mentioned to the doctor, I was like, I've never experienced this before, but when I look at the screen, the pixels just like are so much more evident on the screen that it like hurts my eyes. And he was like, yeah, that's normal, like that should go away, and it did. So it's just part of the recovery process, I guess.
Okay, cool. Yeah, I just know that my 1 week post-op follow-up is this upcoming Thursday.
Nice.
So I'm just ready for him to be like, yeah, you can throw away that mask now. That's really the only thing that's like holding me back. Like, I don't know, my eyes, thankfully right now, knock on wood, they don't feel itchy or super uncomfortable, except for whenever I stare at a screen for a really long time. So hopefully the cloudiness goes away. That was also kind of concerning this morning, especially with my mask being like halfway on my eye.
Yeah.
But overall, I'm still able to see, so I'm assuming that flap's still there.
Yeah, for sure. I think so. They like they'll also check your pressures too, your eye pressure, because one of the side effects or potential side effects for LASIK is for your eye pressures to go up. So they'll check that, and then they'll check the flap, and they'll check your vision. And he told me the same thing, that because of my astigmatism, I'll probably need an enhancement. But my cornea was already on the thinner side of normal, so I don't know if that would be the best thing for me, honestly. But like going from like a -7 that I was at to even if I needed, like, if my prescription was -1, I'm like, whatever, like, you know what I mean? I can see so much better. I don't want to go through another procedure just for that.
That's true, yeah.
Especially if it's like 10 years down the road, like, whatever, at that point.
Yeah. I don't know. I feel as if, like, I don't know, right now I'm pretty happy with how things are.
Yeah.
I don't know if I would need an enhancement as of right now, but I know that it kind of is very variable, it changes. But all I know is that if I can see as clearly now, or like later, and if I can see even better, that'd be great. I'm pretty happy right now, just because I'm able to like not wear glasses anymore.
I know, isn't it wonderful?
It is wonderful.
It's such a great feeling to like wake up and not think about, oh, I need to put my contacts in, or I need to put my glasses on.
Yes.
And you can just go about your day and like see.
It's
you
really
have sight.
It's really weird though, because whenever I go to sleep at night, I'm like, oh, I need to take out my contacts. Like, oh, just kidding, I don't have to take out my contacts.
That, like, I had that thought for a straight month afterwards. And I was like, wait, I have something in my eye. No, I don't. I do not.
Yeah, so even more like, oh, do not touch your eye.
Do not touch your eye. Yeah. But, guys, I didn't know if you knew this, but I actually just found out yesterday. you know how, like, growing up, whenever our prescription changed, it was always the one option that was given to us was like, oh, we need to change your glasses prescription, we need to change your contact prescription. But actually there's these, and I'm sure they've been around for a long time, but a lot of people just don't know about them. You can get these hard lenses for your eyes, and you put them on just at night, and it, like, reshapes your eye so that you can see the next morning. So, like, for the next 24 hours, you can see without glasses or contacts, and that, like, keeps your eyes from getting worse. So it keeps from your prescription from getting higher and higher.
Interesting.
So if you guys have bad eyesight like we do and don't want to do LASIK yet, think about getting hard contacts or talk to your doctor about it.
There you go.
Talk to your doctor.
You sound like that you're being funded by Big Pharma right now.
Oh no,
like,
I don't. Is it okay for me to say that? I don't appreciate what Big Pharma does, but.
But aside from that, so that's kind of what's been going on with my eyes. That's kind of the big thing that came on this past week.
Yeah.
Aside from, interviewings, and I'm pretty sure they're kind of tired of hearing how my interviews are going. But anyways, did you tell them that you're going to internal medicine and not family?
Oh yeah. So unlike Ollie and Dave, I am going into internal medicine. If you guys have any questions about our two fields, please leave it in the comments. We will do our best to answer your questions. I think there are a lot of similarities between internal and family. We do a lot of, there's a lot of breadth in both of our fields. Some differences, family medicine also takes care of kids. They also take care of pregnancy and women's health and that kind of thing. And in internal medicine, if that is something that you're interested in kind of like adolescent care, women's health, there is a space for that. But generally, internists do a lot of either go into a hospitalist position where they stay in the hospital, kind of take care of those who are admitted for certain things, or they go into different subspecialties. Like if you wanted to be a cardiologist, for example, you would want to be going to internal medicine residency, then you'll do a cardiology fellowship. So that's kind of the few similarities and differences between our two fields.
Cool, Niki. Yeah, thanks for explaining that.
Of course. I always get that question, like, what does internal medicine do?
Yeah.
And so this is what I always say to people. When you get admitted to the hospital, the doctor that takes care of everything for you, that's the internal medicine doctor.
Though, slight caveat, don't forget, some places family med people can do internal med as well.
Which
it just depends.
Which is really cool, I think, for someone who wants to do more with their family medicine title or like training. I think if you went, also correct me if I'm wrong, but if you went to like a school or a program that was, didn't have an internal medicine residency, or just family medicine residency, or just family medicine and like a few others, the family medicine residents and the family medicine practice would act as the internist. Mm-hmm. And you would get a lot more training as in the hospital than you would outpatient. So I guess it kind of depends on what you're looking for your career in family medicine. But I know for places near here, it's a lot more outpatient driven. So a lot of our family medicine residents do a lot more of their training in the clinic setting, which if that's what your career looks like, if that's what your end goal is, that's what you want to be looking for.
Yeah, for sure. Yeah, cool. Well, yeah, because I know that me and Alia sometimes talks about like family med.
Yeah.
We don't really know who's all listening. Sometimes there might be a pre-med or somebody out there. So cool. Thanks for explaining some of the medicine and nuances, because I know that probably what is it? I don't know if you've had interviewers ask you why didn't you do family med as opposed to IM. I don't know. I didn't really get that much from family med so far, but I mean overall they haven't been that picky in terms of.
No, I haven't had as many interviews yet as you have, but the few questions I have gotten hasn't really been why internal over something else. It's just been why internal.
Okay.
And I think that's a fair question for anybody going into any field, like what really drew you to this field. And I mean, there's a lot of things for me personally for internal medicine. Right now, I'm unsure if I want to do a subspecialty.
Yeah.
So that's one thing. Internal offers a lot of options further along your career. And I know I want to be in the hospital. Like, I don't love the clinic. Like, I do appreciate my clinic time where I can like not be in the hospital for 12 hours a day, but I think I like the acuity of the hospital, and I don't know, there's just the pace of it. So those are a few things, but I haven't had anyone explicitly ask me, why not family med?
Okay.
Or why not
That's fair.
something else?
Yeah, and now to think about it, family med's been like, why family med?
Yeah.
So I guess it's fair. But anywho, I guess speaking about internal med interviews and everything, so I know recently the last time I spoke to you and hung out with you, we were talking about interviews, like prepping for interviews. Yeah. We were on the river, but a different side of the river walk, actually. And so basically, I know that... sorry, there was a dog that was walking.
There were people walking by, guys.
Sorry, but anyways, oh man, what was my train of thought? Anyway, okay, so it's been a hot minute since I've seen you.
Yes, it has been quite some time.
And it's because you went off to LA to do like an AI or something, an AI's acting internship. Yeah. So tell me what was happening. What was LA like?
Oh my gosh.
You can talk a little bit about like the hospital, where you what you do on your downtime, all that.
So I had a great time, first of all. So kind of some background on how I actually went to LA for you guys. If you are, in medicine or have any desire to be in medicine, you might have heard about doing some rotations not at your home hospital or home school and trying to experience other hospitals out there if that's something that you're interested in. Usually an away rotation is more geared towards people who want to do surgery or OBGYN, things like that. But for me specifically, I really wanted to go to a bigger city, a bigger hospital, just to see kind of what that experience is like. I wanted to know how different hospitals operate, because all we've known is our hospital. You've been in Florence and here, so you've kind of seen a little bit of both, but I've only seen this hospital. So that was something that initially drew me to apply for an OA. When we moved to America, we were in California, and I've never had the chance to go back. So I wanted to take an opportunity during our 4th year, when we have a little more flexibility in our schedule, to do something and learn over there. So I was in LA at a pretty big hospital system there. I was in a medical surgical rotation. So basically what we did was all the surgical patients that were in the hospital, we managed any medical conditions that they had. So if their blood pressure wasn't controlled, if their sugars weren't controlled, if they had any like heart failure things going on, things like that, we just managed. Sorry guys, another airplane. I'll let it pass. But so that was kind of like the setup of the rotation. It's something that we don't have at our hospital. It's something also that we're not really taught in med school, of how to, what do we do during a pre-op visit? What do we look for post-op? So it was a pretty unique experience in that sense. I was able to work with, multiple different subspecialties, was calling consults. It really was like an acting internship, because I was the only med student on with 2 senior residents. So I really was kind of shocked at how welcoming they were. They didn't really treat me as if I wasn't part of their program. They really, not just the residents I worked with either, the other residents that were in like the lounge, they all, involved me in their conversations. Some of them even just like sat down and taught me different things about my patients, even if they weren't actively seeing that patient with me. So I think overall it was a really, really good experience. I was nervous because it's a huge hospital, and I've never worked outside of my hospital, never worked in the city by myself. But that's kind of the hospital part. And again, great experience. Definitely would recommend, if anybody is, anyone out there who is thinking about experiencing different hospitals, go for it. You don't get these opportunities a lot. If you're happy with where you are, you kind of know what you want to do, that's also fine. You don't have to do these things. But if you want to see a little bit more about what's out there, at least put in an application. It doesn't hurt. LA itself, it's LA. It was, if you like big cities, you'll like it. It is very busy. The traffic is horrible.
Is it worse than Atlanta?
Actually, I would say Atlanta's is worse.
Okay.
Honestly.
Okay, cool.
there are a lot of ways to get to the same place in LA. Granted, they are always busy, but I don't know. I mean, I feel like it was annoying to be sitting in traffic for like 2 hours just to get to somewhere that's like 30 miles away. But it wasn't like the noisy, like people driving crazy Atlanta traffic.
Okay.
And I think because my residents were very nice in that if I didn't have too much going on, if the rotation or if the service was pretty quiet, they would let me go a few hours early. And so I was able to see a lot of things while I was there, even during the weekdays and especially during the weekends. And so I kind of went all around LA. I've already been there once, so I've already seen downtown LA, so I didn't tour that area as much because I'd just seen it. But I went to Glendale, I went to Burbank, I went to Pasadena, Santa Monica. So everything's like where I was, it was pretty central to everywhere. So it was really nice to just go and like explore the city as not a tourist. So also the food is absolutely amazing. Like you can literally get anything. Literally. And you have so many options for all these different cuisines, and they're very authentic. They were really, really good. I had really good Korean food, had Japanese food for the first time, was so good. And the hospital gave us food every single day.
Oh, wow. Is that part of their program, too? Like, as an intern, or is that just as a...
No, so they do get catered food, pretty often, okay. But it was like a hospital appreciation month when I was there. Oh, so they were giving food to everyone, not just the residents. It was literally the entire hospital that was getting food.
Wow.
But even their cafeteria was really good, too.
Okay. Yeah, you don't hear that much.
No.
Like, you don't hear any compliments at all. Hospital food.
It was good. And then, what was I going to say? The only thing, though, it's very expensive.
I can imagine, yeah.
It is very, very expensive to live in LA. The gas, I spent $50-something to fill up half a tank of regular gas. Like regular gas, Dave, was almost $5.
Oh, jeez. Yeah, meanwhile, right now, we're paying like $3?
If that, right? Like, if you go to the right place, you can get regular gas for like $2.58 or something, or $2.85, whatever it is.
Yeah, like half.
Yeah, so it was just like,
that
was such a shocker to me. Like, I knew it was expensive over there, but not that expensive. And, like, the inflation is terrible. It's terrible. Like, the food was so good, but it was so expensive. Like, even getting breakfast, literally just a breakfast sandwich, $13. How can this be?
That's wild.
And, like, yes, it was good, but, like, oh my goodness. That is one thing. Like, I loved everything, but it took a toll on my bank account.
Okay, yeah, I can imagine.
So that is something I will have to consider. But, I mean, I loved it. It was so, so fun. I experienced things that I, like, wouldn't have it in any other city. And even though I was, like, technically by myself, I have family there. I have so many of my close friends that are there. Even my residents, like, they don't know me, but, like, even week 2, they invited me out to dinner. They invited me out to, like, karaoke.
Oh, wow.
Like, it was such a good experience.
Did you go to karaoke?
I didn't. I was hanging out with my friend that day, so I didn't get to go to karaoke, but I did go to dinner with them.
Okay.
And they were just, like, so nice and accepting. And the one thing, though, no one says excuse me in LA.
Huh.
I guess number 2 things, I guess. But I feel like we're so nice in the South. We're just like, excuse me, I'm sorry.
Yeah,
whatever.
In the South, I feel like there's some parts of the South where it's like they just say it just to say it.
That's
and
true.
It's like not really.
Yeah.
Especially like, Atlanta.
Somewhere
like that, where it's like, excuse me, but they're not like, excuse me.
Yeah.
Like, it's like the tone's a little bit different.
Yeah.
It's like really they're just saying it just to say it.
Just to say.
Yeah.
Bruh, no one even says it in LA. Like, I was the one always being like, excuse, like in the supermarket, right? Like when you're walking in front of somebody, you're like, excuse me, and then you walk. And no one says that. They just like walk in front of you or like walk really close to you, and I'm like, like, please, back up. Or say excuse me, or like something. Make your presence known.
That's fair, yeah.
But to that con, there is this pro. Everyone wears a mask.
Oh, yeah?
Every single person wears a mask. You don't have to be told.
Yeah.
Like, we went to our breakfast place today.
Yeah.
We were the only people wearing masks.
Well, no, the workers were.
Well, the workers have to, dude. Nobody else was.
That's fair.
Meanwhile, when I was in LA, I went to a coffee shop because I was still, doing interview prep and stuff like that. So I still had work to do.
Yeah.
So I was at a coffee shop doing some work, and I ordered a coffee for there. And the worker immediately was like, "Can I please see your vaccination card? And please keep your mask on while you're at the table." And I'm like, "Okay, I will." Like, why is that a bother to people?
I guess because, I don't know, right now, I know the vaccine and everything's a very hot topic.
Yeah.
I guess maybe because people are kind of just tired of it, and so...
I get that. I mean, it's not great for your skin.
Yeah, it's fair.
And it's annoying.
Yeah.
It can be hard to breathe in.
Yeah.
But I feel like it's doable for the health of our community.
Yeah.
But also, I really would love to talk to people who have differences in opinions on this, because I really genuinely, and if you guys have any opinions on this, please leave a comment. I genuinely want to know. Everyone always is like, people are going to fight about it. I don't want to fight about it. I just want to know.
Yeah, that's fair.
I want to understand your train of thought and then explain my train of thought.
Yeah, that's fair. I don't know.
I don't know either. But overall, I loved LA. With a capital L.
Well,
highly recommend.
Well, who knows? Maybe you'll end up matching there. So you'll see.
You guys can't see, but I'm crossing my fingers.
It sounds like a very expensive match.
I know.
But hey, if you do end up there, I
the
may fly out there.
Tax day.
Yeah, I may fly out there.
You should.
And just be like, hey, everywhere's expensive, so I'm just gonna sleep on the couch.
That's okay.
Yeah.
If I do end up there, everyone is welcome.
Okay. Cool.
All my friends.
Yeah, we'll see. It depends on where I match with vacation days and stuff too. But yeah, well, I'm glad that your trip to LA was good.
Thanks. That's gonna be like my last trip.
Yeah,
Well, I mean, I'm trying to plan a trip with one of my friends, either closer to match or right after graduation.
Gotcha.
But my dad also wants to take us to Africa, because he was born there. Fun fact, guys, my dad was born in Africa. So he's always wanted us to go to Africa, see kind of where he is, and or where he grew up. So maybe that'll be happening soon as well.
Very nice.
We'll see.
Yeah. Well, best of luck with your traveling endeavors.
You.
I do have some traveling endeavors too, but I'll go into that a little bit later.
Okay, no spoilers.
There is a slight surprise.
For the podcast world.
Yes, but however, we'll cross that bridge later.
Sounds
I briefly mentioned it to Niki already, but
I'm already in the inn, guys.
Yeah, she is already in the inn. But all right, well, I guess overall, do you have any last words of wisdom it could be for anybody out there, whether they're pre-med or whether it's just a human being out there? Any words of wisdom that you want to give to our audience?
Words of wisdom.
Yeah.
I don't know if this counts, but I know right now with the new variant, things are a little scary, a little hectic. It can be a cause for anxiety for a lot of people who have kind of gone through that first quarantine stage, second quarantine stage in some countries. During this time, I would just encourage you guys to not get too worried. We are more prepared this time. We have vaccines. We know we should wear masks. We know what we need to do. So try to protect yourself and your families as much as you can. Do your part. We can't force people to do what they don't want to do. So just, control what you can and don't get overly worried about what you can't control. And that kind of goes for everything in life. Like right now with our match stuff, all we can do is control what we can and not really stress about what we can't control. So just do that. I think that'll help with everyone's anxiety and try and make this process be a little more easier.
Very cool. All right. Well, Niki, thanks for joining us.
Thank you, Dave.
You may be invited again. Who knows?
I'd be honored.
Okay, cool.
Guys, give this a lot of likes so I can come back.
Yeah, I mean, hey, maybe one day I'll invite both you and Ollie at the same
Oh,
time, and
triple threat.
just let you guys just take it over, and I'll just like walk out of the room.
Oh, this would be a very long podcast if you did that.
Probably. But all right then. Well, I guess everyone have a good week or whatever day it is. But yeah, I guess we'll check in with you guys another time.
Bye.
Bye.